In the cutthroat corporate and NGO world, the struggle to meet deadlines and attend constant meetings is pushing employees to a dark place. In May 2020, when the gates of Butabika Hospital loomed over Hellenah Okiring Oketcho, she suddenly found herself gripped by fear.
It was scary because I didn't know what to expect. I'd heard all these stories. So it was like, what am I doing here?
The 35-year-old mental health activist, who describes herself as an overachiever, had been recommended to the psychiatric hospital after she broke down from the stress of work.
Over time, it started to take its toll. I began to feel irritable. I had so much body pain. I found myself, this was one that would scare me, I was always on the verge of tears. In the middle of the night, I just woke up, I was having so much pain, and I started hitting my head uncontrollably against the wall.
In April 2020, Okiring began working as a technical advisor at a women's organization. She was excited but apprehensive. The first total lockdown had just been declared, so she met her workmates on Zoom.
Zoom calls were not the exception, they became the norm. And because I was new on the job, I really wanted to deliver, but also because I enjoy the work, you know, that I was doing. It was around helping women, deal with gender-based violence.
With some of her colleagues living abroad, Okiring found herself taking calls and answering emails at all hours. To cope, she began to abuse painkillers.
After the Zoom calls, I would have very painful headaches. At first, of course, you start with Panadol. Then I started taking diclofenac. Then, I don't know, like a gel, a muscle relaxant. It got to a point those things stopped working.
When she eventually broke down, her cousin, who is a psychotherapist, advised her to go for a mental health assessment at Butabika Hospital. Okiring was diagnosed with an anxiety disorder and myalgia. Her treatment regimen included medication, rest, psychotherapy, and physiotherapy. In early July 2020, after her doctors gave her the green light, Okiring informed her bosses that she was ready to return to work. She sent them her medical forms, but shockingly, in response, they fired her. In that dark moment, the threat of relapse was imminent.
My family members, my friends, had time to just sit and talk with me. And it wasn't toxic positivity, like, no, you'll be fine. It was just an acknowledgement that what had happened was terrible, and it was wrong.
As part of her healing journey, in September 2020, Okiring began hosting the Mindful Show, a YouTube channel to promote mental health education.
For you to heal, you have to change what your mind tells you about what you are going through, so that what you hear on the inside doesn't break you. If the story inside is you failed, you're a failure, you're a mental case, if that's the story you're hearing, that will keep you in a place of victimhood.
Her work on the Mindful Show brought her personal healing, unexpectedly, a husband. She is now expecting their first child. She was also recruited as country director of Blue Cross Uganda, an international NGO that deals with substance abuse among children and youth.
And what goes on in our minds.
Many workplaces are toxic. Employees' contribution is not valued. They are not given support to perform their work, and some are denied leave days or are even bullied. For many, though, quitting or resigning is not an option.
Know your limits. What can you do? What can't you do? Learn to say no. Being a person who likes to deliver, I used to have many tasks on the table. Now, I've learned to say no, I cannot. Have a life outside your workplace, have someone you can talk to. Don't bury it alone.
In the corporate world, your worth to the company is tied to your last performance evaluation. This is a stress factor, but you must protect your mental health. You can start by setting boundaries, like switching off your mobile phone the moment you leave the office. Gillian Nantume, NTV Tonight.